Dr. RJ Bruno, and today I wanted to talk a little bit about laser lipolysis. Now, there are two forms of laser lipolysis. In one case, a surgeon makes a incision in the skin, puts a laser probe inside the skin, and then shines the laser on the fat area, disrupting the fat cells, and then uses a liposuction catheter to suck out all of this fat. So it's used in conjunction with the surgical technique of liposuction. Again, if you do this, it still has all the risk of liposuction, which I've discussed before. Any surgery can cause problems with bleeding problems, with infection problems, with scar tissue. This is a technique that if you decide to do it, just remember your insurance is not going to pay for it. So it could be thousands of dollars out of pocket. The non-invasive laser treatment shines the laser through the skin using a device. Once again, shining the laser on the fat cells causes the fat cells to disrupt. And then the fat is removed by the body over time. These usually require multiple treatments to be done. The full results may not be apparent immediately because the fat has to be removed by the body. There are some complications with laser therapy. Usually, this is done so that no laser is shown in the eyes to cause any injury to the eyes. Laser can cause some discomfort in the area where the fat is being removed. But again, in general, it's nowhere near the kind of complications we're talking about when you're talking about a surgeon cutting into the body and removing the fat tissue surgically. Because I'm a physician, I always tell people, if you have any questions, you should talk to your primary care doctor. I also have been helping out a friend of mine, Melissa Quinones, and I have a link to her in my Facebook page, to her Instagram page, where you can get further information. So try to discuss this, get a consultation from the therapist, see if you qualify for this technique. All right, take care.